Hi, my name is Liv, and I'm an education mental health practitioner for Hampshire CAMHS. Emotions are normal, and everyone can experience a range of emotions day to day. Sometimes, particularly when we've had persistent, distressing experiences during our lives, we can emotionally react more often to situations where we feel threatened. The distress and emotional response can be very intense, and it's difficult to manage ourselves in situations when things are feeling so overwhelming. In these moments, it can be hard to think clearly, communicate our needs, and regulate our emotions. This is because our sympathetic nervous system, our body's central stress response, becomes overstimulated. Watching your child go through suffering and distress and experiencing mental health difficulties is a significant and persistent source of stress to parents and carers, and therefore it is likely that as parents you will experience more intense emotions and feel overwhelmed and dysregulated at times. This can make it very hard to parent well in these moments and support yourself and your child at your best. When you are dysregulated, you may feel hypo or hyper aroused. This can look different for everyone. However, common symptoms parents and carers report feeling is shut down, numb, passive, withdrawn, having feelings of shame, and becoming easily angry, frustrated, or on edge, hypervigilant, tired, in a state of fight or flight, or unable to think clearly. Some describe very physical symptoms, such as tension, neck and shoulder pain, headaches, or stomach problems. Often, parents and carers will share that they feel guilty for experiencing these intense emotions. However, it's very normal and understandable in the moments to feel this way. It's also important to recognise that when we are overtired, hungry, or not able to meet our basic needs, this will also make it more likely and quickly for us to become emotionally dysregulated. As having a child with mental health challenges can intensify emotions and be very exhausting, practicing emotion regulation skills will help you learn to effectively manage and challenge the way we feel and cope with these situations. This will quickly bring down intense emotions in the moment and help you regulate your body's natural stress response. There are many ways we regulate our emotions, through the small pleasures we enjoy in life, or through taking a break from various stresses. One method, outlined by the Get Self-Help website, to regulate our emotions is the STOP method, STOPP, which considers how whilst we often cannot change a situation, we can change how we feel about it. It's a very simple and quick technique. It has to be simple so that you can use it in moments of heightened stress. If it's not simple, you won't be able to use it. The app What's Up, the mental health app, also will go through this step by step in the moment with you, so it's a great way to practice it. This is the STOP skill. S is for stop. Wait a minute before responding to a situation with emotion. T stands for take a breath. Notice your breathing in and out. You can control your breathing through a variety of breathing exercises, such as square breathing, where you breathe in through your nose for 4 seconds, hold your breath for 4 seconds, breathe out through your mouth for 4 seconds, and hold your breath for 4 seconds. By controlling our breathing, we can control our heart rate and the fight or flight or freeze response. O stands for observe. What are you thinking? What are you reacting to? What sensations can you notice in your body? It can be helpful to attempt to label some of these thoughts. P is pull back. Try and put the situation into perspective. Is there another way of looking at the situation, or another way to respond? What might a friend's advice be right now? How important is this now, and how important will it be a year from now? And the final P, practice what works and proceed. What is the best thing I can do? What is going to be effective and appropriate whilst aligning with my values? Let's think of a day-to-day example this can be used in. It's important to practice first in situations that are not too emotionally evoking, so it's easier to successfully use. In this scenario, your child's room is a mess and there is homework that needs doing. Stop. Wait 30 seconds. Take a breath. You may need to take a few. Observe. You may feel really angry and feel that your heart is racing. reacting not only to young person's actions but over perceived lack of control over their behaviour. You might notice sensations in your body, such as your heart rate speeding up. Pull back. Your child is only 11. There may be a reason for the lack of order and organisation. Whilst you may feel you can't bear it, you may have to. You may be able to see, whilst shouting might not help, we can't help reacting. Practice. You might choose to stay calm, ignore it, or explain to your child that we need to take a break before speaking to them about it. It's difficult to recognise when we need to take a break from a situation, but it can often lead to a more rational response. It's important to highlight that sometimes as a parent, in high-stress situations with your child or family, you might need to step away from the situation for a few minutes to use the stop skill and regulate your emotions. This will help you to manage your emotions in the moment, so you can think clearer, respond calmly, and de-escalate the situation. As long as it feels safe to do so, it's absolutely okay to step away from the situation to do this. If you're not regulating your own emotions, it's really hard to regulate your child's. It's also important to remember that these skills take practice, and it will be easier to respond in ways that align with your values if you're supporting yourself. Practice these first when you're calm, so it becomes more automatic to use it in heightened states of emotion. A bit like learning to ride a bike, it's often a lot easier to learn when we're feeling calm. Find a time each day that you can practice it. In our Parent and Carer manual, we suggest other emotion regulation strategies you can try for yourself and for your child. Why not give them a go and see what works best for you?